rather than being competitive, we have to put the patient first and start saying what's in the best interest of public health. And the World Health Organization says that integrating traditional medicine knowledge into primary health care is in the best interest of human health and planetary health together, environmental and individual.
Herbal Radio is brought to you by Mountain Rose Herbs. Mountain Rose Herbs is committed to putting people, plants, and planet before profit. They work hand in hand with farm partners to provide the highest quality organic herbs, spices, extracts, teas, essential oils, and DIY ingredients. Mountain Rose Herbs is proud to be independently owned and operated here in Eugene, Oregon. Please visit mountainroseherbs.com for all your wellness needs. And now, on with the show.
For Herbal Radio, I am Lucretia VanDyke, author of African American Herbalism, and I am so excited to be here today with Roy Upton. I'm so excited. And Roy, please introduce yourself and tell us about your organization.
I'm the president of the American Herbal Pharmacopoeia. We're a 501c3 nonprofit, and our primary goal is to promote quality control standards for herbal product ingredients, but also we do complete therapeutic and safety reviews, a complete review of how the herbs should be picked, dried, cultivated, processed, pretty much everything that anybody needs to know to use the herb both safely and effectively. And we integrate both traditional knowledge as well as scientific knowledge. And the real power of these, Lucretia, is that after each of the sections are done, like botany, chemistry, analytics, therapeutic, safety, they're sent all over the world to medicinal plant experts for peer review. And so they represent the most comprehensive monographs written on that particular botanical anywhere in the English language. And pretty much everybody who's seen them says it's the gold standard in the world.
Yes, and how long have you all been around, been doing this?
It's actually, last year was our 30th anniversary. So it's been 30 years. This will be 31 coming into July or something of this year. So it's been a great ride, and I hope we have another 30 more.
So for our newbies out here, our new herbalists, will you explain what a monograph is?
Yeah, a monograph basically is a dossier that, and typically for a pharmacopoeia monograph, and actually, let's back up a second. A pharmacopoeia is actually originally was a book of standards and a book of recipes by how you made an herbal product. Then they evolved into becoming a quality control setting standard so that you knew you had the right herb, you had tests for identifying it, making sure that it was free of adulterants, whatever tests were needed to make sure that it was the right species, for example, and the right quality. That was the key, the right quality. Originally, those monographs were based on what they looked like, taste like, smelled like, sensory, organoleptic characterizations. And then as chemistry kind of blew up, chemistry took over. So testing for this compound and that compound, sometimes looking for active constituents, sometimes just looking for marker compounds. But basically, they became monographs that focused on chemical and physical identity. The AHP monographs outline everything. The traditional botanical, macroscopic, organoleptic, microscopic, and chemical characterization of the herb, plus all the other information that we as herbalists know goes into making a quality herbal medicine, where it was picked, how it was dried, what it should be combined with, dosages, side effects, contraindications, use in pregnancy. Does it affect driving, and does it interact, for example, positively or negatively with conventional medications? So that's a monograph that at least the AHP monographs outlines all of that information.
I love that. And how difficult, or maybe it's not difficult for you all, is it integrating both traditional, and with science?
There's no difficulty whatsoever, Lucretia. They're two disparate but overlapping bodies of evidence. So, for example, when you look at something like willow bark that's been used since the third or fourth century, or St. John's wort used since the sixth century, for example, for willow bark arthritis, or St. John's wort for melancholy and mental health. And then you see that, 800, 1,200 years of continued use of those botanicals for those specific indications, as well as other indications. And then you see systematic reviews, randomized controlled trials, or meta-analyses supporting the use of willow bark, valerian, St. John's wort, and a myriad of our herbs for the same indications. There's no disparity there. They're just two different bodies of evidence, one based on human empiricism and then one based on clinical research. Just they blend together beautifully most of the time.
Most of the time.
Yeah.
I see you have a beautiful collection of some books back there. We were chatting about that before. What is some of do you use a lot of these books in your research, correct?
I use almost all of them at some point in time for different botanicals. So, there's one section that's just materia medicas and pharmacopoeias that include, like, from England, Ireland, Scotland, Germany, the United States, France, and then others that are dispensatories, others that are the Renaissance herbals. There was about 200 years of people producing these herbals during the Renaissance times out of these huge tomes. I mean, they're huge.
Wow.
1,500, 1,600 pages, but oversized and just drop dead gorgeous. And those were the collections of physicians who wrote about the herbs, not just academicians or people. They were practicing physicians who both looked at what the ancients said about that particular botanical, and then in many cases added their own experience. So we have 2,000 years of clinical research collected on these herbs just in human empiricism, which sometimes is not given the credence that it should be given. If you experience something, that's your experience, and that's a data point in any system of science. But many times traditional knowledge is basically marginalized as, oh, that was old wives' tales or something like that.
Yeah. I think it's brilliant that your company does have so many of these old texts, because I think in herbalism and herbal education now, it's just like we have a kind of a point of which most people do reference, and they don't go back that far to look at some of this information. That's always been important for you all, I see, with your book collection.
Absolutely. Right from the beginning of AHP, we used to actually, my entree into the book thing started with us developing what was called the Botanical Safety Handbook. And the Botanical Safety Handbook is a collection of about 850 botanicals in which we classify them according to their category of safety, 1, 2, 3, etc. And when we started doing that, we were hanging out in Christopher Hobbs's library, which is actually a big part of it is now freely online as of last week. So people should look for that. But we would hang out in his library because, remember, this was before the internet. It was before we all had personal computers. Yeah. And we would just by hand, pull the books off the shelves, write down what they said. And, like, this guy said something, but then we he referenced this guy. And so we'd have to go back there. And, he referenced her and she referenced him, and would have to trace it back to who said this originally and how much credence did it really have. And that's the key about assessing traditional knowledge. You have to assess it critically. Who said it and what was their basis of reference? How much experience they had? Did they hear it from somebody else, but they've never seen it in clinical practice, especially regarding safety issues? So that's where it started for me, was doing the Botanical Safety Handbook, and with Chris Hobbs and Michael McGuffin and myself, just pulling books off the shelf. And that's in its third revision right now, that botanical safety handbook. But you do a lot of this, a lot of these types of books have not been digitized yet. So when people go looking for information and they get an AI review or something like that, it's not picking this up. And AI is not going to critically assess what was the basis of their experience. Did they really know what they were doing? Like this one book, a guy named Tabernet Montanus wrote a book, and I'm not going to say the year because I just forget, but let's say it's just in the 1700s. He wrote that book when he was in his 80s, and he had practiced medicine for most of his life, so 60 years. So that book represents 60 years of his accumulated knowledge, including all of the accumulated knowledge on Western herbs that existed before him. That's mind blowing.
It
In
is.
Chinese medicine, we have a Materia Medica from 1568, I think, by Li Shizhen. He recorded the all of like 765 different texts that came before him, wrote it down, and then he wrote his experience and the experience of this current generation about that particular herb. This is a massive amount of beautiful literature that we have in the historical works.
I love just your passion behind it, the idea, because I don't think a lot of newer herbalists have that drive to go back and really study herbalism sometimes in that way. Um, and then also like the effects of AI on modern herbalism. I've been seeing so many newspaper articles on people, getting sick or, from AI foraging. What are
Oh,
your thoughts about AI and herbalism?
one of the things that we've seen recently is the publication of books that are completely fabricated. They have an author name, they have a biography of the author that's completely made up, and then the herb information is whatever AI generated. Who's starting these projects? I have no idea. Then now there's also books that are being plagiarized by AI. So, for example, Simon Mills is one of the most well respected herbalists in the United Kingdom. He's written several books and has been an authority and a well respected herbalist for 40, almost 50 years, I think now. And a book showed up with his name on it that he never wrote.
Yes.
And we know also that, one of our favorite folkloric herbalists is Rosemary Gladstar. Now there's books coming out with the author Rosemary Gladwell.
Hmm.
It's like they're just spinning this stuff. And I get sucked in on my phone looking at Facebook reels, and I see these beautiful images in the savannah where a lioness brings her cubs and gives it to a tourist in order to while she fights off the hyenas. I love it, but it's fake,
I know.
right? It's all fake. Or the jaguar comes out of the forest and starts rubbing up against the woman, like she's
Yeah.
like a kitten. And like, no, that's not going to happen. Don't try to do that with a bobcat, lynx, or a mountain lion. It ain't going to work, But they're beautiful to watch, but
Yeah.
it's horrible, literally, and it's really come to head in the last probably 5 or 6 months. You realize that what can I trust? What
Yeah.
can I really trust? It looks like Stephen Colbert, sounds like Stephen Colbert, looks like Stephen Colbert's dying of cancer, and he's not. Right?
Yeah.
It's just it blows my mind.
As a book scholar and a researcher and a writer, are there any tips that you can give people to be able to identify if something is AI written or not?
You know what, Lucretia, I have to apologize that I don't.
Okay.
I have seen some tip sheets out there, but I
Mhm.
haven't committed them to memory, or like you start to see it. If it looks too good, if it basically looks too good to be real, it probably
Exactly.
is. Um, but on the information side, it's very difficult, which is why I like going to the original sources, and
Yeah.
that's both in the books, in the historical literature, as well as in the scientific literature, because sometimes you see research mills pumping out inaccurate information too. And a lot of time, I know, first thing I'll do is I'll look at the authors. Um, I've been around long enough that I know a lot of authors in different countries, Iran, China, and India, Europe, North America, some in South America. So usually that's one flag if I know it's real. And then if I see something like, where is this from? I'll actually, if I have a question about something in the study, I'll actually reach out to the authors and say, you know, what was your characterization of the extract? Because it wasn't clearly articulated in the material and methods section of your article, and most of the time you get a response from authors that way because they love that their literature is being looked at.
Yeah, I love that. What do you think is the oldest book that you own there?
I know what it is. It's actually just a piece of a book in this bookcase. It's from 1493.
Wow.
So just after, Colombo stumbled onto the Dominican Republic. So it's a fragment of this just old book. That's my oldest.
Oh my goodness, that would be so interesting. I mean, I'm sure just bearing witness to all of that. How do you find these books?
In the old days, it was looking in bookstores. Every
Yeah.
city we would go to, first thing we would do is look for antiquarian bookstores, and then everything went online, right? And now, ever since everything's been online, now it's online. But when I started, and a couple of us started, 30, 40 years ago, the books were very reasonably priced because herbal medicine was not, that sexy
Yeah.
at the time. But since then, both with the digital age, they've actually pushed the prices up. They're not
Mhm.
making these anymore, right? So they get rarer
Yeah.
and rarer, but they're not making them anymore. But the book deals also have to keep the prices high because they can't compete in the
Uh-huh.
commercial market. So even though they might sit on a book for 10 years, sitting on their shelf, and they're not going to reduce the price of it just to move it because that's not their business model. They have to
Mhm.
keep their prices high in order to keep their doors open.
Yeah. I
So it's
got
getting
really
harder and
lucky.
harder to find.
Yeah, I got really lucky. There was one that was really hard to find, and I was with David Winston at a conference, and
Yeah.
he actually mailed me the book because he had it in his collection and gifted it to me.
What was it?
It
Remember?
was, gosh, right now my brain is in a fog.
Oh, that's okay. Don't
Um,
worry.
yeah, I have to look at. My brain is in a fog with that one.
Yeah,
It was,
David and I and Christopher Hobbs and a guy named Bob Brucia, we probably have the most extensive herbal libraries in person besides like
yeah.
Mrs. Mellon, the Mellon Library was huge. That was the biggest personal collection, and then the Lloyd Library is obviously the biggest, collection in North America. But as far as just herbalists, myself, Christopher, Bob Brucier, and David Winston, we had some good stuff, and most of it overlapped, and some of it didn't. But yeah.
I would love to sit around with all of y'all talking about all of your old books and book adventures. David was hilarious talking to
David
him
has
about.
some better stories than I do. Like he says he needed elbow pads when he was looking for books with Christopher and Bob, because it'd be knocking each other. Oh, I saw it first, and David like, you can have it, please take it.
It's lovely to see fellow book nerds and book
Yeah,
enthusiasts in
yeah.
there, and like you all give me so much a more of a drive to get in there and dig through. I know spending time with David. Um,
Wait a minute, but I did one thing that they didn't. I
what?
took book restoration classes so that I could find some of these books that were less expensive than if they were in pristine condition get it something that was maybe $3,000 for 1,200, right? Because the binding was falling apart. So I
Wow.
would then take it and completely rebind it. So now it's good for another 300 years. Plus, I got a book less expensive than most everybody else. So that was one thing that I did that these other guys didn't do.
Wow. Roy, you just keep getting cooler and cooler and cooler. I cannot. I'm like
Uh,
all of it. I'm like, you were probably the cool. I've always been a book nerd. Like I remember how, the Dewey Decimal System card thing, like when you roll it out, like it's still a visceral memory of me of
yeah,
how that smells,
yeah, yeah, yeah,
that wood in there.
yeah.
So let's get back to monographs. How many monographs do you think that you all have?
Oh no, I know how many. Well, I do know exactly. I think we have 47,
Okay.
um, which are the most comprehensive in the world. Like I said, we have one textbook on the microscopic characterization of plants. We're working on a second volume of that, and we're working on a macroscopic textbook. How to this is especially useful for herbalists, is how do you identify in a scientifically valid manner the authenticity and quality of a botanical just using sensory assessment, your sensors,
Yeah.
and providing the scientific basis of that. And we're working on that in conjunction with the researchers at the University of Mississippi, um, as well as University of Vienna in Austria with the microscopy work. And then we have in conjunction with the American Herbal Products Association, we're very active in developing the Botanical Safety Handbook, documentation on good agricultural and collection practices, and other miscellaneous things like that improve the kind of the credibility of the herbal products world. And then, in conjunction with the American Botanical Council and the National Center for Natural Product Research at the University of Mississippi, we participate in the Botanical Adulteration Prevention Program, which is freely available to anybody if they're interested to
Mhm.
know, are there common adulterants to echinacea, to ginseng, to whatever the herb. They could go and access the BAP program, BAPP program, through the American Botanical Council, and all that information is freely available to them. We have bulletins that say what those adulterations are, and then we have lab guidance documents. We're just developing one on elderberry, but laboratory guidance documents that says these are the types of tests you would use, all the way from botany to macro to microscopy to chemistry to genetics, on how to tell you have the right stuff.
Oh, wow.
And
So
that's freely available.
that's amazing. That is such a valuable resource. I've had so much fun learning about all these extra things that you all have and putting that in my little herbal drawer also. Quality control is really important to you all.
It's I think Ed Smith was one of the first ones that I heard come out of his mouth, Herbal Ed Smith from Herb Farm. And Ed said, garbage in, garbage out. If you start with a good quality herb, you have to be stupid to mess it up. But
Hmm.
if you start with a poor quality herb, you have to be a magician to make something good out of that. And a lot of people do this, and a lot of people don't realize this, that a lot of the extracts that are manufactured on the market are really using poor quality herb, but they use these highly toxic solvents, methanol, chloroform, hexane, to pull out the deepest resources of the chemistry that's in the herb that you wouldn't normally get out just with a tincture or syrup or a tea.
Yeah.
And so that's what the herbal products industry has, in a large part, has become. And then there's companies that they make their whole business practice, Lucretia, is based on using the dregs of one industry and marketing it as a dietary supplement herbal ingredient. And cranberry is the perfect example, where these companies specialize and they take the leftover mark, right? What's left over from pressing out cranberry juice, that stuff's called press cake, and it has none of the proanthocyanidins that you want for, or very few, for urinary tract health. It might be good for stomach, right? For like H. pylori, but
Yeah.
it doesn't have the same benefits as a true cranberry extract. And then what they do, they take enough cranberry juice, pour it on the press cake to pass any test, AHP's test, USP, any pharmacopoeia test. That's called sophistication. It's not
Wow.
outright adulteration, but
Yeah.
it's sophistication. It's making something that's crap look better than it really is. And the kicker is they sell it as a cranberry extract. They don't
And
sell it as an extract of pre-extracted cranberry to which juice has been added back,
oh
right?
my
So
goodness.
then it sits on the shelf side by side with the real cranberry extract, but at a fraction of the price.
What do you believe are some important things that people should consider when sourcing herbal products and herbs in general?
They have to know their sources.
Mhm.
I think to me, and scientists don't like this, and regulators don't like this, but to me, word of mouth is the best. I've
Mhm.
used this product in my clinical practice or in my own life, and I see this company's work over and over and over. Right? This I always I'm always satisfied with this product, or it looks and tastes like and smells like the herb that I expect to get.
Yeah.
Like if you get saw palmetto oil for your husband who has or boyfriend who has prostate stuff,
Mhm.
and if it doesn't smell like dirty socks, it's either vegetable or animal oils that have been mixed to pass the test. But it better smell like dirty socks or valerian root, for example, right?
Oh, yeah.
So the herb should have the character, the product should have, when you open that bottle, it should have the characteristic, sensory characteristics of that product. That doesn't inherently mean that it's the best product, but you know
Mhm.
that it at least is reflecting what should be in that herb. Then other than people like, for example, you know David Winston well, so
Mhm.
you know he has herbalist and alchemist, so you have a high level of confidence in his products. Herb Farm, I've always considered to be one of the most highest quality extract tincture manufacturers on the market, but Herbs Etc., Vitality Works,
Mhm.
there's a simplers, there's a lot of them that we know in the herbal community. And then there's what I call the European phytopharmaceutical products that are made by pharmaceutical companies in the European Union that have clinical studies, formal toxicological tests, and adhere to good manufacturing practices because they're actually sold as drugs in the European Union.
Yeah.
So then there's, for example, there's a 2-volume set of clinically tested herbs by a pharmacognosist named Marilyn Barrett, and up until the date those were published, those list a large percentage of the herbs that fit into that category, those herbs that have clinical backing to them. Um, but that was 10 or 15 years ago. So it'd be nice to do another edition of that to capture everything that's been clinically tested today. And I think that would be the thing is here's my two guiding points. The first, who's the company that made it? And who's behind that company. So are they herbalists, naturopathic physicians, functional medicine docs, integrative medicine docs? Are they actually practicing? And therefore, do they know what they're doing and actually have patient centricity as their primary goal?
Mhm.
Okay. So who's behind the line? You got to do holistic health requires that we engage, that a patient engages. It's not a passive thing of just taking a pill that somebody tells you to take. You have to learn the dietary things, the lifestyle things, the stress reduction things, and about the herbs and nutrients that you need to shift your condition, right? It takes engagement. Same thing with assessing herbal products. It requires a little bit of engagement. So that's the
Yeah.
first thing. Who's behind the product? If you know that they're focused on patient health, you have a higher level of confidence that they're minding the shop. Second would be is do they have clinical research backing their product? And actually, I'll add a third one. And those companies with the clinical research, they'll be able to provide you with the clinical research most of the time, with one exception, that regulations tend to restrict the free dissemination of information in conjunction with the sale of a product. So that's a little bit problem, even though the law actually allows it, but regulators don't like it. The third thing would be is if you contact a company, you ask them, what quality control standards do you use? And they're going to say,
Mhm.
well, can you be more specific? Well, who's authenticating the material that you're using? And what tests are you using to authenticate that material? And here's the key. They don't have to know the answer. The person asking doesn't have to know the answers. They just need to know that they're getting feedback that sounds like, oh, yeah, these guys know what they're doing. So, for example, one company might say, oh, we follow traditional assessment methods using macroscopy, organoleptic assessment, etc. Or we use HPTLC, or we send this out, every ingredient out to a third party lab, or we have our own internal lab and we do this, we do this, we do this, and we do this. They should be, if it's not on a company's website, which I think it should be. For
Yeah.
example, if you go to Gaia's website, they had the Meet Your Herb program where you could
Mhm.
track, you could look at, you could have a bottle of their finished product. It has a batch number, and you could go right to the website and learn everything about the ingredients, where they were from, whether they were organic or non-organic, fresh or dry, whatever it be. Trace it right back. It was one of the most innovative quality control initiatives I've ever seen a company do.
Wow.
So these are the things we have to ask of our manufacturers.
Thank you so much for that. I'm always, I made the mistake one time of teaching a class at a location that I didn't vet their herbs. And so during the class, it was just trash. Like
Uh,
they were burnt and dry. Like holy basil didn't smell like holy basil. And I was like, that's one of the most fragrant herbs that, mint. You couldn't even tell it was mint.
yeah.
And so as I see herbalists, young herbalists, I don't think a lot of programs center quality control, as much as they probably should, like letting people know, especially when you're just getting a quick, weekend class on the internet.
But that's also why organoleptic sensory assessment is so critical, because probably most of those herbs they had passed some test that they
Yeah,
did that allowed them to approve of it and put it in their product. Otherwise, they
exactly,
wouldn't have had it. They would have thrown it away or returned it. Um,
exactly.
so you can never underestimate the value of your own senses in assessing quality of individual herb ingredients, and that's underemphasized and underutilized in the industry.
Yeah, exactly. And that's what I had to just basically, even if I offended the owner of the place, I'm like, I can't let you think that these are great herbs. One of the big things I see, you've talked a lot about, you integrate a lot of different people on your team, scientists, chemists, and all of that. And then you were also talking about healthcare system in Europe as opposed to here. How are you all bridging the gap between the healthcare system in other nations, and what is your work here also?
So that's a twofold question. The first part is that with AHP and our monographs, those have influenced the manner in which other countries do their herbal research.
Mhm.
They've been probably the most impactful monographs that any of that's ever been created, because now everybody looks at the AHP monographs almost like a gold standard that says, like I was just talking with the head of a European society 3 days ago in Switzerland, and they produce monographs, and they're like, Roy, your monographs are like so much better than ours. And I'm like, no, yours, I consider yours the best, because of the scientific rigor that they use in putting them together. Now, we put in history, they don't. We put in pictures, they don't. We put in
Mhm.
quality control, they don't. They only focus on therapeutic and safety. But, they're like, Roy, these monographs of yours are like pieces of art. They're beautiful. And FDA, they've told us for years, the first thing we have a question about an herb, we go see if AHP has a monograph, because if you have a monograph, we know everything we need to know is going to be in that monograph, and they love it. So this has changed things actually worldwide. It's changed in the European Union, and it actually led to the development of monographs in Hong Kong, where they developed like 172 monographs. They got $48 million to do it. I've never been given $48 million, so I only have 50. But
Yeah.
they were given $48 million to do 172 monographs, and they're still continuing that work, but they based it on our monograph system, on how we did it. So that's how we've influenced that part of the world.
Mhm.
International. I should have said the world internationally. Our cannabis monograph, one of the sponsors, which was American for Safe Access, the director was Steph Shearer at the time. She took that monograph all over the world, and within 5 years, the regulatory models by which cannabis had been restricted in many other countries, including Thailand. Thailand, it was still a caning offense to just
Wow.
possess cannabis,
Yeah.
and that's gone now. And worldwide, she used our monograph. Look at what the United States is doing. Look at what the United States is doing. And they even had representatives in like the Bulgarian legislature holding our monograph up, saying, this is what we have to create, here.
Mhm.
So individual monographs and the monographs as a whole have had a great impact worldwide. But in the last year and a half, I launched the Global Alliance for Integrative Health and Medicine, GAIAM. The genesis of that came out with my participation in a WHO, World Health Organization, global summit on traditional medicine, where I saw what was happening in the rest of the world. And I was so ecstatic and also so pissed at how little is being done here formally. At the WHO meetings, you had, Ministry of Health, assistant ministries of health. You had Prime Minister Modi. You had Tu who was the Nobel Prize winner for the discovery of artemisinin that led to, from wormwood, from malaria. The wife of the president of Turkey. All of these types of people are presenting. The six of us or so who were from the U.S., we were all private. There was one 5-minute presentation from an FDAer by Zoom, but almost no U.S. representation and no U.S. initiatives that were really presented, other than, again, what we were individually doing
Mhm.
as groups. This was so disparaging on the U.S. and what we do and how we do it. Um, that I felt like we needed to change. And so I founded GAIAM. Right now, it's part of AHP. Maybe it'll morph into a separate organization, but right now it's part of an AHP initiative for the most part, with European partners and African partners, South America, China, India, Iran, Turkey. We have
Mhm.
partners in 135 partners in like 35 or 38 countries. So our job will be to try to break silos. Everybody is working separately. The naturopaths, the TCMers, the Ayurvedic people, the midwives, the whatever. Everybody's doing their stuff separate, but it's all the same. We face all the same challenges: quality, education, credentialing, whatever resources. We all face the same thing. So why are we facing these challenges separately? We should face these challenges together. And that was actually the message of the WHO. The European director of the World Health Organization said, we all live in silos and we need to break these silos. He was talking about the silo between conventional medicine and traditional medicine, but it's the same concept. Rather than being competitive, we have to put the patient first and start saying what's in the best interest of public health. And the World Health Organization says that integrating traditional medicine knowledge into primary health care is in the best interest of human health and planetary health together,
Yeah.
environmental and individual. That's what I love about the message. So to me, that was a game changer, and that's what we have to emulate here. So,
Yeah.
I'll encourage people to go look for our GAIM, GAIHM
Mm.
.org website and get a sense of what we're doing, and also how people could become a part of that.
I love that so much. I mean, what are the challenges that you faced with trying to get doctors to kind of get on board?
I don't think the challenges are so much with the docs, because what we're looking for are docs that are engaged already. We don't want to, you're not going to talk to the president of Harvard unless he's trained in integrative medicine, because he'll just say, oh, this stuff is crap. We don't know about it. We don't teach it. Where's your science? It's not enough for us, blah, blah, blah. It's not, it's not approved by FDA. Have a good day, right? That's not who we want. We want Mary Hardy. We want Andy Weil. We want Bob Roundtree. We want the Tiarona Low Dogs of the world, the integrative medicine docs that know both worlds. So that's the first thing. So I don't find a big challenge there. The bigger challenge I find is that comes from our own ranks, infighting between different groups, naturopaths, TCMers, Ayurvedic, because everybody's vying for the same patient base. So they have to kind of say how good they are and not necessarily say how good somebody else might be. So they want to say it's invented here, right? They want to maintain ownership. That's the biggest sticking point. They want to maintain ownership. One of my goals is to say who's doing what the best that benefits the whole, and let's share it. Like, for example, like this two volume set of clinically tested herbal books. I went to the author and I said, "Hey, how do we do a second volume of this, an updated version of this?" Oh, well, I get royalties from that. And I'm like, okay, how much royalties do you need to either sign over the copyright or just let us, is it $10,000 or is it $100,000 or is it $1 million? What is it? What's that number to share your information so that we can take it to the next level? You're doing this beautifully over here. How much money do you need in order to keep your lights on that will allow us to share it with the world freely? Because what you're doing is critical to the European Union, Asia, India, Iran, anywhere in the Middle East. What you're doing is critical to this whole world of healthcare, but you might reach 1,000 people, nerds, in your own group. Let's reach 1 million worldwide by getting you the resources you need. So that's the second sticking point, is money. It's always money. If you have to rely on volunteer work, it's going to be done in 15 years marginally. But if you have a focused plan and a focused budget, specific deliverables, specific timelines, specific participants, then you can say, I need $3.1 million a year for the next 3 to 5 years to do this, this, and this. And
Yeah.
that's what we hope to do, is to be able to raise that kind of money in order to have these very specific projects that we consider to be foundational to moving the needle, like using herbs in children. Almost everything you read, we don't know what they do. We don't know how they're metabolized, excreted, their dosage, their side effects. No, there's 2,000 years of information. We do know it. You don't know that information.
Yeah.
You're comfortable about eating broccoli, spinach, cauliflower, and kiwi fruits, even though there's no formal clinical studies or toxicological studies, because you're familiar with those. You're not familiar with goji berries, chrysanthemum tea, and hawthorn, right? But they'll accept eating breakfast, lunch, and dinner with no toxicological screening. But then when it comes to Triphala, an Ayurvedic herbal formula that's been around for 2,000 years, they go bonkers.
Yeah,
It makes no sense. So, that's one of the fundamental things that we want to change, is how to, that you don't have to be afraid to treat children with herbs. That here's my biggest one, Lucretia, is that there's 650,000 hysterectomies performed in the U.S. alone, half of which are considered unnecessary by second opinion, and all of which are done because women don't know they have any other viable option. So how do we develop the evidence base to show that women do have an option, and then disseminate the crap out of that? That's a scientific term, disseminate the crap. Disseminate the crap out of that information so that when any woman is faced with a hysterectomy, not necessarily for cancer, but for like functional endometriosis, fibroids, PCOS, things like that, very straightforward. There are very well clinically relevant protocols in Ayurveda, traditional Chinese medicine, functional medicine, naturopathy, where the hysterectomy is not needed if the woman changes, uses herbs, diet, lifestyle, etc. And most women don't know that they have that choice. So how do we, again, disseminate, get that information, build the content, build a consensus around the content, which is what GAIAM is meant to do, help build global consensus that this is a scientifically, or I should say a clinically supported protocol for gynecological health, and then disseminate the crap out of it so that women know they have a choice. You know what? And it's not going to be for everybody. And of course, it's not going to work for 100% of the people, but they can always go for the hysterectomy later. At least we need to tell them that they have viable options, and that's not being done today.
Yeah, and I find that, the people who are offering a lot of this herbal advice don't have as much of the research globally to be able, they're doing a one size fits all kind of plan, which doesn't work for people either.
Sometimes that's true. The more interesting part of that, though, Lucretia, is that in Western medicine, and this is conventional and Western herbal medicine, there's no underlying diagnostic understanding for why a woman gets PCOS, endometriosis, uterine fibroids, many aspects of functional infertility. Pieces of them are known. Oh, we have a hormonal imbalance, but the hormonal balance is just what you're seeing. What's behind there, right? So they try to fix it hormonally. Or you might have a physical obstruction in infertility. Okay, that's a physical thing that probably no herb is going to change either, but they have pieces. They don't have a unified diagnostic understanding of why that gynecological imbalance is. Again, cancer aside, that's a different pathology, but they don't have an understanding of why that gynecological imbalances occurs in the first place. Chinese medicine, in my opinion, has that nailed down. Gynecology has been a subspecialty for several hundred years. they know how to treat functional gynecological imbalances.
Especially like I've run into some, myself included, that also had to have a hysterectomy from that. And like I keep finding these women younger than I am, all within this like past year that have had the same thing.
PCOS.
So not PCOS, fibroids have been the biggest one for that I have found. And like, as young as like 35, having to have hysterectomies.
Crazy.
And it's, even at dinner the other night, it's just like these women are starting to come, and with my journey and trying to figure out, like doing more intense studying about, what you're talking about. So I really appreciate you all trying to have that effort to really help something that's so close to home for me as well.
You have to use that and say, how can you participate in making this happen? That's what I need with Gaiam is we need like-hearted and like-minded people who know the story and know the potential and want to contribute a part of. I've said this to David. I've said it to a number of people in the herb industry. Most of us have 10 to 15 productive years left before we croak or get Alzheimer's and can't do crap anymore. And so what are we going to do to move the needle?
Yeah.
And what are we going to do to for lack of a better word, inspire a next generation of people to pick up this mantle by charting a road? Mm-hmm. This is where we came from, like these books. This is where we came from. This is where we're going. This is where we've gotten to up until this point in time. These are some initiatives that we believe that are foundational. Now let's clear a path. What are your ideas? What do you believe the future of medicine or healthcare should be? Whether you're doing it in the home for yourself, or whether you're doing it as a practice, or whether it's in a global system. And that's what gets me up in the morning these days.
Yeah.
I should say that's what keeps me up at night. Yeah.
Exactly. Me too. I've just gone down the rabbit hole of like, how do I use my story to be able to inspire other people, and where my research has shifted, and trying to gain that knowledge and like helping the younger people. I believe the same. That is so true. What are some other services that your organization provides?
One of the biggest ones is we provide what's called botanical reference materials to industry, researchers, and regulators. So by law, every manufacturer of an herbal product has to know that they're using the right stuff. How do they know that? They have to compare it with something that's been independently verified to be the right stuff. And pharmacopoeias overall, United States Pharmacopoeia, European Pharmacopoeia, Chinese, American Herbal Pharmacopoeia, Ayurvedic Pharmacopoeia, part of our job is to provide these botanical reference materials. So, for example, last year we hit the 10,000 BRM mark, botanical reference material mark, in providing more than 10,000 of those to the world over the last 15 years. So that's one of the primary ways that we generate revenue. But it's also one of the other primary services that we have. A secondary service is that we act as an extension of good manufacturing teams. So, for example, if they become a member of AHP, if they get stuck on something quality, hey, we have a question about this seaweed, the identity of this seaweed, they might send the seaweed to us for identification. We go out and find a seaweed extract. Like we had one case, somebody brought a seaweed and they'd been working on it internally for 3 months. And I said, you know what, send me the material. And luckily they had a pressing of it. They send it to me. In 15 or 20 minutes, we were able to find a seaweed expert in Ireland. And we sent them a picture. Hey, is this such and such seaweed? And, oh, no, but it's closely related. They get mixed up all the time. No, that's not the right one. He sends me a picture of the right one. And then he says, oh, and I know the guy who did that. this one, and he's an absolute expert in this species. And in 15 minutes or 20 minutes, we were able to correct a problem that they had been working for 3 or 4 months. And this has been multiple times. Somebody else looking at a toxic ingredient or an ingredient that somebody said was toxic that shouldn't be in the formula. In 20, 25 minutes, we were able to find out, no, there's trace amounts in this herb that's in your formula. At that concentration, it's not toxic, but that's going to test positive on your test. So it was a right and a wrong. Yes, that compound's there, but you didn't know it was in this herb. So we act as an extension. Lastly, is that people oftentimes will actually send us their herbs and say, can you provide us with the identification on that? We look at it, we touch it, taste it, smell it, send it out for we don't have our own lab. So we might send that out to an analytical lab if the macro and morphological identification is not definitive. So we'll send it out for HPTLC, DNA, or HPLC analysis, and then we provide that third-party confidence back to the supplier.
Oh, wow. So how can people get involved?
2 ways. One is they can go to the American Herbal Pharmacopoeia website and see the monographs that we have. Now, they're priced more for manufacturers than individuals. Only the most geek of the geek, are going to put out $50 for a single dossier on Hawthorne, right? So yeah. I put that out as a caveat. It wasn't priced for individuals because that's not our market. The bigger way to get involved is by going to the GAIHM, the www.gaihm.org website, to see how they might want to plug in to what we're doing globally. So, or if there are writers out there, like we're always in need of writers, historical writers, integrative medicine writers, pharmacologists, toxicologists, integrative docs, sometimes naturopaths or, naturopathic physicians have the ability to do this type of writing, pharmacists, integrative pharmacists. So we're always looking for writers and reviewers so that we can produce more monographs.
I love that. Thank you so much for all this information. Thank you all so much for what you're doing for the herbal and the world and doctors and everybody and getting us all on the same page. I appreciate it. Happy 31st anniversary. Yes. And I also read a tidbit. You all want to have 300 is your goal of monographs?
Yeah.
That's amazing.
Yeah, because 300 represents the majority of the Western, Chinese, Ayurvedic, and South American or African herbs that are on the market. Our mission is not inherently to create a monograph for everything under the sun.
Yeah.
Our real mission is, Lucretia, is to establish this foundation of both traditional and scientific knowledge that says, this stuff's legitimate, guys.
Mm-hmm.
Whether you're a consumer, a patient, a physician, a regulator, a researcher, here's the scientific base for the majority of the herbs that we have in trade that started with their recording in these types of books and have come into the 21st century with formal clinical evaluation, either through formal clinical research, RCTs, randomized controlled trials, or through formal authoritative reviews by Canada, the European Union, the Middle East medical authorities all over the world, with the exception of the United States, have critically reviewed the majority of the herbs that are in their markets, first to make sure that they're safe because consumers are using them, and then to determine the level of confidence there is in their effectiveness. Almost every other country, Lucretia, has done this, and the U.S. has not, and it's pathetic. And that has to change. So come and help me change it, is what I would say.
Yeah. It is. It's just flabbergasting to me that we're the last ones on board in this thing in America.
Money. Yeah.
Money, yeah. That's just the biggest thing. Again, thank you all for this. I look forward to learning more about Gaiam, the project, and I look forward to looking at some of your resources and getting my hands on some of the monographs as well and looking at those.
Just
Thank you.
just look at my list. Tell me what you want. I'm happy to send them to you.
Oh my goodness.
Yes.
I so appreciate that.
And we do that for individuals who are in the world of herbal geekum, geek world. So we want to make it accessible to individuals. So feel free to reach out.
I appreciate that. I am definitely an
And
herbal
anybody
geek.
else, and any other individual that is interested in a particular botanical that we might have, we'll do our best to make it accessible to you.
Oh, I appreciate that. And in the name of all of this geeky herbalists in the world, thank you for joining me on Herbal Radio, Roy.
Thank you.
Good luck to you all and all your endeavors. And again, thank you all so much for all this work that you're doing behind the scenes.
Well,
Thanks,
thank
everybody,
you.
for joining us. Please look them up, research. Their website is amazing, has a bunch of resources and questions. I had so much fun just kind of going through there. And we'll talk to you on our next episode.